Today, I'm going to share our experience of conducting our study JASPARC, focused on the application on crowdsourcing approach to reduce HIV stigma and promote HIV self-testing in Kazakhstan among adolescents and young adults. So JAS translates from Kazakh as young. So translation of the name of the study is Young Spark. And on the picture you can see our volunteers who helped us to conduct this study. Oh. Why it's not moving? This one is not working. Oh, okay. I have no conflicts of interest to declare. We would like to thank National Institute of Child Health and Human Development and the Fogarty International Center for funding our research. All study protocols were approved by the IRB of Columbia University and Al-Farabi Kazakh National University. So this study was a result of joint effort of US-based investigative team from 4 universities, Columbia University, UNC Chapel Hill, Boston University, and RTI, and a Kazakh-based investigative team from the Columbia Global Health Research Center of Central Asia. And this study, I want to point that Alisa Davis is multiple PI who worked on this study together with me. Just now you have seen the HIV in the region, that globally rates of new HIV infection have decreased or remain stable, but in Eastern Europe and Central Asia, we observe increase in new HIV infection. And for Kazakhstan, we also observed large increase for last decade. HIV infection in Kazakhstan are disproportionately concentrated among marginalized populations, such as people who inject drugs, among sexual and gender minorities, and people who have sex, commercial sex, and among their partners. But in Kazakhstan, 1 in 4 new HIV infections occurs among adolescents and young adults. And rates among adolescents and young adults are rapidly rising. Main reason of that is that it is very low HIV testing rates in this population, which is because of HIV-related stigma is a major obstacle to HIV-related protective behaviors, including HIV testing. Stigma is a complex phenomenon that can manifest in many different ways, which include experienced stigma, perceived stigma, witnessed stigma, anticipated stigma, internalized stigma, and intersectional stigma. And in this study, we are focused on a reduction of anticipated stigma, the fear or expectation that one will experience stigma. So to conceptualize our study, we used an HIV stigma framework that was developed by Laura Niblade. So according to this framework, uptake of different steps of HIV care continuum, like testing, linkage to care, intention, are driven by stigma manifestations. And the stigma manifestations also driven by the key immediately actionable drivers, such as awareness about stigmatizing attitudes and how stigma actually drives epidemics, fear of being infected by a simple casual contact, and stigmatizing attitudes. So in this study, we focus to disrupt these immediately actionable drivers. In our study, we had 2 main aims. Aim 1, to develop a crowdsourced digital HIV stigma reduction and self-testing intervention for youth in Kazakhstan. And second aim, to test this crowdsourced HIV intervention to determine its efficacy in reducing HIV stigma. So for phase 1, we developed a crowdsourced intervention package. And for that, we announced call for crowdsourced contest in Kazakhstan, and we expected to receive about 50 submissions from our participants. Then we screened these submissions, provided feedback, allowed them to revise and resubmit these works, and then our judging panel had to score these submissions to select the best works to include in the final intervention packages. All winners received prizes. So for those who haven't heard of crowdsourcing before, crowdsourcing is when a group of community member researchers and professional workers work together to solve a problem and then sharing solution with the public. So, opposed to conventional top-down approach, it is bottom-up approach. And crowdsourcing is considered as a powerful tool that can engage the local community to reduce HIV stigma and promote HIV testing and other protective behaviors. So here you can see eligibility and contest detail. So in our crowdsourced contest, participants participated from 13 to 29 years. They could submit their works in Russian and Kazakh languages. It was allowed to submit individual or group submissions. They could submit more than one submissions. And these media materials could include audio, video, image, or text. And submissions should be focused on reducing HIV stigma to promote HIV testing. Since we want to use this content for intervention package and then disseminate these materials, we asked them to sign and submit a media release forms. To motivate and stimulate participation in the contest, we established prizes for submissions, and you can see what kind of prizes. So we launched the contest on World AIDS Day, December 1st in 2021, and promoted the contest online because of the COVID-19 pandemic, and used numerous social media outlets. In addition to that, we contacted several universities and colleges and provided informational sessions via Zoom meetings. And you can see here that the majority of our participants received information about these contents via social media, about 60%. That resulted in almost 4,000 website visits. Of them, unique visitors were about 3,000, and that resulted in 77 contestants. 77 contestants produced 96 submissions, which were twice more than we expected. And you can see that we received submissions from all regions of the country. So for the second phase of the study, we conducted randomized control trial. For that, we recruited 216 adolescents and young adults from Almaty, aged from 16 to 24, who had sex in the past year and reported to be HIV negative. We conducted baseline survey assessment, then randomized our participant into two-arm crowdsourced intervention arm and control arm that received standard of care information. After that, we provided a link to order HIV self-test kit. And then after that, we observed our participants for 3 months and conducted 1 month follow-up assessment and 3 months follow-up assessment. Our primary outcome for this randomized control trial was a reduction of HIV stigma, and secondary outcome is HIV self-test order. We conducted multi-level linear mixed model to assess within group and between group changes in mean stigma. We also conducted moderation analysis by sex. And for secondary outcome of HIV self-testing uptake, we conducted logistic regression to examine whether the intervention was associated with increased HIV self-testing uptake. So on this table, you can see social demographic characteristics of our participants in intervention and control arm. And here you can see results of our analysis in terms of mean change of perceived community stigma from time 1 to time 3. So I receiving the digital crowdsourced intervention had a significantly greater decrease in HIV testing stigma at the 3-month follow-up period compared to I receiving the standard of care. On this table, you can see a moderation by sex. And you can see that effect was moderated by sex and was particularly prominent among female adolescents and young adults. Female participants receiving the crowdsourced intervention had a significantly greater decrease in HIV stigma overall at both 1 month and 3 months follow-up periods compared to male participants receiving standard messaging materials. So, and results of logistic regression to evaluate efficacy of our effectiveness of our randomized controlled trial regarding HIV self-test kit ordering. Trends indicated that intervention arm were more likely to order HIV test during follow-up than control arm. But we didn't reach the significance level of 5%. So this study has several limitations. First of all, this study was conducted among adolescents and young adults in one city in Kazakhstan, in Almaty, but the crowdsourced contest was conducted throughout all country. Study was conducted entirely online, so it might be biased towards those young people who are more engaged in online activities than those who are not. And unfortunately, study was underpowered for secondary outcome. So in conclusion, we want to say that findings suggest that crowdsourcing intervention was effective at reducing HIV stigma among adolescents and young adult females in Kazakhstan compared to standard of care materials. And crowdsourcing may be a promising low-cost method of engaging community members to develop HIV stigma reduction and testing intervention in other settings. And I would like to show, since I think I have still time, one entry of our participants that you could have an understanding, an impression, what kind of materials they developed.
Возможно, это тяжело принять. Часто неприятные мысли затмевают голову. То, что случилось с тобой, может сломать каждого. Но не тебя. Потому что ты знаешь, что твои родные и близкие будут рядом. И ВИЧ этого не изменит.
Watch that, right? So this is another one. This is from other old category. Mulțumesc!